Well, good morning, everyone. This is Mike Hill, and I'd like to welcome you to the first of our 5 webinar series on the moving pieces inside a self-funded and any health plan for that matter. I invite you to use the Q&A section to ask me questions as I present this afternoon, and my goal is to have this wrapped up by 12:30 at the latest. What I hope this is going to be is a very informative conversation for you and give you some food for thought, and one meeting will build upon the other. And so at the conclusion of our series, you'll have a good sense of the opportunities you have as a person that comes into contact with an employer-sponsored health plan to manage the plan as well as you would like to. So excited that you can be here, and we're going to kick this thing off. So once again, welcome to Anatomy of a Self-Funded Health Plan. This is part 1 of a 5-part series, and the goal at the conclusion of this series is for you to have a good sense of all the moving pieces within a health plan and to allow you to be able to control the plan as much as you want to. So real quick recap of the series and what we're going to cover last Wednesday of every month now through June, 12 to 12:30 Eastern. Today we're talking about administration and data. Next month, we're going to talk about provider access. And what do we mean by that is, do we use a traditional employer network or a carrier network, or do we go about it a different way? Then we're going to talk about how we manage the pharmacy components of a health plan. Next, in May, we're going to talk about medical management and what that can and can't mean to your health plan. And finally, we'll talk about stop loss and all the different angles you can take when trying to mitigate risk within a health plan. Today, again, we're talking about the administration of a health plan. And so we're going to talk about the role of an administrator, the primary models at a very high level that administration can take, what you should expect from a data component of the plan, what you should expect to get, or what you should know that you can get in certain scenarios. And then finally, we'll wrap it up with some final thoughts. So first, we're going to talk about the role of the administrator. So I want to try to keep this very, very simple, but at the most basic, the purpose of a plan administrator is to facilitate the payment of claims related to healthcare services that plan participants receive. And so the entity that fills this role is your plan administrator. Ultimately, every plan has a plan document that dictates how it's supposed to operate. The plan administrator looks at that and then pays the claims appropriately. If we think about it from an employee perspective, the most tangible representation they generally have about their health plan is that plastic ID card in their wallet. And it may seem like health insurance is a relatively simple topic, but in reality, behind that plastic ID card, it's a very complex machine and there's a lot of moving pieces. And the plan administrator ultimately is the entity or individual that's responsible for coordinating all those various moving pieces that make that ID card work. And so it's the most important component of a health plan. It is the chassis or the framework upon which everything else is added. And that's why it's really important as a individual that has a role in managing an employer-sponsored health plan to understand who the administrator is that you have and why you picked them. So we are using, for those of you that are a little bit nostalgic, you may appreciate the Operation Gentleman that we used as the promotion for this series. And you may want to be asking yourself, why are we talking about this in the role of playing a game? Why am I equating managing a health plan to playing a game? First and foremost, we think it helps simplify. I'm a visual guy, and so it helps me kind of understand the complexities of a health plan and what it is that we're ultimately talking about. So trying to simplify the topic. But as importantly, many employers hire us because they feel like they're at the end of the rope with their typical health plan. They feel like it keeps getting more and more expensive and the market is not responding to what their overall goals are. So they hire us to help them control the cost of their health plan. And when we view managing a health plan like a game, then we understand that there's the opportunity potentially to win. And so we want to make sure we get ourselves a seat at the table and we're able to play the game and give ourselves a chance to win. And that's why we're also using the game analogy. Why is this conversation important? This is a slide from Kaiser Family Foundation, and we're talking about self-funded health plans here today, but ultimately the concepts we're talking about apply to fully insured plans as well. Here's the thing. Healthcare costs are not going down, health insurance costs are not going down, and there's a growing trend of employers to pivot towards self-funding to give themselves an opportunity to change the trajectory of their plan. And this survey from Kaiser Family Foundation illustrates the employers by size and the percentage of employers in each size range that self-insure today. Ultimately, 65% of all firms self-insure. In Indiana, employers have been self-insuring for years, employers of all sizes, from 30 employees on up. In Michigan, self-insuring is not as prevalent, and it's starting to pivot, though, and trend in that direction. And so as you contemplate your self-funded plan that you may have, or whether or not you should have one, this is going to give you a good foundation that you can use to make the best decisions for your plan participants and your organization. Okay. So let's cut to the chase here and get into it. Let's talk about the three primary models that we have when we're looking at different administrators. And here's the thing to keep in mind. I'm speaking in generalities today. So trying to look at a very high level of the different options. If you're starting from a blank sheet of paper, the options you have to pick an administrator for your plan. On the left-hand side, we have traditional insurance carriers. So those would be names that you'd recognize, your Blue Cross Blue Shields of the world, United Healthcare, and in West Michigan and throughout Michigan, for example, Priority Health would all fall into that category. In the middle, we have carrier-affiliated TPAs, so a third-party administrator, but one that's either owned by or affiliated with a commercial insurance carrier. So has some of the features of a third-party administrator, but also is ultimately controlled or influenced by a commercial insurance carrier. Finally, on the right-hand side, we've got our completely independent TPAs, your choose your own adventure. And at the top, we have a bit of a spectrum here that, generally speaking, insurance carriers tend to be more grounded in the status quo. When we talk about health insurance, the health insurance we all know, a self-funded plan administered by a commercial insurance carrier is going to feel and smell very much like that. TPAs, on the other hand, have a lot of flexibility, and if you hear about some new concept in a health plan, it's likely starting with the TPA world and then migrating over time to the carrier world. On the bottom, though, we also want to talk about that there isn't a right answer to the particular question on which model is right for you. They all have pros and cons. And so as we look on the left-hand side of the spectrum, there tends to be, generally speaking, less transparency and control on the left-hand side, but also less complexity, one for the plan sponsor and two for plan participants. As we move our way right more towards the TPA and then ultimately the independent TPA model, we get greater transparency, you get greater control, but we also add to the complexity potentially for both you and your plan participants, and that may or may not be a good thing. So these are the three primary models that we're going to talk about today, and we're going to dive into the insurance carrier model first. So going back to our gentleman from the game operation, you may see this and say, gosh, it looks familiar, but I'm not seeing any bones or organs to remove. And the reality is we know underneath the skin those exist, but our ability to access them and ultimately play the game is more limited in this model. And again, I want to please add a disclaimer that I'm speaking in generalities here, and there are some insurance carriers where we can see the bones, and we'll talk about that. But first and foremost, we're going to dive into the pros and cons of this particular approach. So pros. What are some pros of using a commercial insurance carrier as your administrator for a self-funded health plan? Number one, they bring generally a brand name to the conversation. So when we talk about competing for employees and talking to new hires, prospective new hires, and telling them what health plan you have, if you say Blue Cross Blue Shield, they're going to know what that is. For better or worse, they're going to know what that is. And many employees put value on that, and employers do too, and rightfully so. Secondly, a commercial insurance carrier generally typically owns their own network. So they bring a network of doctors and hospitals and providers to the table. Very easy turnkey option for us. It's largely a set and forget model where we're going to sit down with a commercial insurance carrier, describe the plan that we want, work with them to build the features in it that they have the flexibility to build, and then we're going to turn it over to them and they're going to manage the plan for us. When we talk about stop loss later on in this series, that's one key component, a very important component of a plan that has a cost to it. And when we shop that, commercial insurance carriers oftentimes have very competitive pricing for stop loss, and the fees they charge oftentimes for administration is also very competitive. And finally, they tend to be the big fish in the sea. And so they oftentimes have market leverage, both over insurance advisors when they offer bonuses, for example, and try to incentivize us to sell their products, but also with the other moving pieces within a healthcare supply chain. So there's a lot of upside to working with a commercial insurance carrier. What are the things that we want to think about, though? Why wouldn't we want to work with a commercial insurance carrier? Number one, as we talk about, if we move back to our game board here, it's hard to play a game with no pieces. It's hard to win that game. And generally speaking, with a commercial insurance carrier, we've got limited flexibility in terms of being creative, thinking outside the box, or trying to play the game in a strategic way. We also have limited transparency. We know that there's organs and bones underneath the skin, but we really can't see them. Maybe our patients had a bone or a joint transplant or joint replacement, for example, and we just don't know what's in there. If we do want to try to add some game pieces to the equation in this model, generally they have a price. For example, if I want to buy stop loss from the commercial insurance carrier, they're going to sell to me at a pretty competitive price, and it is what it is. But if I decide I want to go to the market and I want to use their model but bring my own stop loss solution to the conversation, they likely are going to charge me a fee for that. And there can be a cascading series of events that happens if you make a decision like that. So we can very quickly start adding cost to the equation simply by trying to play the game more aggressively in this model. Finally, if we think back to the primary role that the plan administrator plays, it is paying claims. And typically in a commercial insurance carrier model, they're using the same model they use for their fully insured plans. And there's a lot of auto adjudication, meaning we're using computers to process claims and no one ever looks at them or touches the claim. It just kind of hits the system and gets paid automatically. When we do RFPs, go to the market and ask these various options, hey, what percentage of the claims you touch are auto adjudicated? It's common to see an insurance carrier say 85, 90 plus % of the claims they touch are processed by a computer. From our perspective, that it leaves a lot of opportunity for things to fall through the cracks. And so we say that's a con. All right, moving right along. Any questions for me? Again, you feel free to put in the Q&A section, but moving right along and right on track here. Next, we're going to talk about carrier-affiliated third-party administrators. And so this is more of a generic term, but what we're referencing here is these are third-party administrators that have their basis or their origins in being an independent TPA that has a lot of the flexibility we'll talk about next, but they've either been purchased by a commercial insurance carrier to provide a new option to their customers, or they've got some strategic partnership, for example, with a commercial insurance carrier. I'll give you some for instances. So United Healthcare, the largest commercial insurance carrier in the country, owns a TPA. They purchased it called UMR. So it's a third-party administrator, but it's owned by United Healthcare. Aetna has their own called Meritain. In the West Michigan market, it looks like in early 2025, Party Health will be coming to the market with a third-party administrator option that is either owned by them or affiliated with them. And Blue Cross Blue Shield of Michigan came to the market a couple of years ago with a strategic partnership with a TPA called Blue Water, not owned by Blue Cross, but strategically aligned with them following their lead. So because we're ultimately using a TPA, you'll notice our game board now has some moving pieces here that we can actually access to play the game to a greater degree. So what are some pros about working with a carrier-affiliated TPA? They have greater flexibility than your commercial insurance carrier. So I use this analogy all the time, but it's kind of silly, but it drives the point home that if we start from a blank sheet of paper with a TPA, we can decide that we want our health plan to cover ice cream cones on Tuesdays in July. And they can program that into their system and the system will pay those claims. If we tried to do the same thing with a commercial insurance carrier, they're either going to say they just can't do something outside the box like that, or they're going to try to fit a square peg into maybe an oval hole at best. Maybe we'll have to add a bunch of riders to try to accomplish what it is that we want, which adds more administrative complexity and also can make the processing of claims more challenging and bring issues to the table in terms of accuracy of payment. TPAs are just simply set up to do basically whatever you want. And so you have a lot more flexibility with a carrier affiliated TPA. If we're affiliated with a commercial insurance carrier, we oftentimes have access to their proprietary network we spoke about before. So we still have access to that big brand name network, which is great, but we have the flexibility of a TPA. TPAs in general have better reporting capabilities, and so we'll have access to better data than we generally would in a commercial insurance carrier setting. Because it's a TPA, they are set up to have less auto adjudication. When we talk to carrier affiliated TPAs in a request for proposal model, they are generally somewhere to 60 to mid 80% auto adjudication of claims. Carriers are high 80s to mid 90s. Carrier affiliated TPAs are in the mid 60s to mid 80s. So less claims are being processed by a computer, which we think is good. And because they're affiliated with these large commercial carriers, they still have the market leverage that we would come to expect. So a lot of perks. Well, let's talk about on the downside, though, the cons. Some of the things that we would like to do with a TPA, we simply can't do because the organization is just, the mothership is not going to let us do it. I'll give you a for instance. So one area that health plans spend a lot of money is on infusions, these expensive medications that need to be administered intravenously. Oftentimes, those are done in a hospital setting, which can be very, very expensive. Some employers have decided to carve that out and control that more aggressively and trying to get that done, for example, at home where appropriate, where it's far more cost effective. In certain settings, if we want to maintain this proprietary network that we have, the commercial insurance carrier is not going to let us start picking and choosing what parts of it that we want to use. And so we're still limited on some of the things that we can do or the creativity that we can have simply because there's other outside forces pushing the carrier to say what you can and can't do. That also then means transparency is still limited. So if we want to know exactly what the discounts are we're getting through a particular network, for example, we're not going to be able to see that in this environment because, again, it's controlled by a commercial insurance carrier that has various reasons that they want to keep that stuff under wraps. Finally, not always, but in many cases, these carrier-affiliated TPAs are still very large organizations. So one reason you might pick a TPA is because it's much more approachable. It's a smaller organization that we can get our hands around. If we want to talk to the top, we can get there. But a carrier-affiliated TPA, especially those owned by United Healthcare, owned by Aetna, for example, are very large organizations still. And so we lose some of the intimacy that we might otherwise get from an independent TPA. All right, moving right along here. Independent third-party administrators. Now we're talking, okay, there's a lot of moving pieces here. So a lot of more opportunity for us to win the game, but also a lot more opportunity for us to make the red light go off on the gentleman's nose if we touch the sides. So we have a lot of opportunity here to be creative and really control the plan, the game the way that we want to. But because we're going to be diving in more deeply, there's more opportunities for things to come off the rails potentially. So let's talk about some of the pros of an independent TPA. They are flexible. At their most basic, that's what they're all about, is providing flexibility, starting with a blank sheet of paper and programming the plan that you want into their system and administrating it that way. So lots of game pieces that we can play with. Oftentimes, independent TPAs bring full transparency. We can get to the root of everything to understand, is what we're being told actually true or not? It allows us to get creative. As I mentioned, if we see that the cost of infusions is going through the roof, we now have the opportunity to think, are there other ways to play this game? If we're trying to go straight in and we keep touching the sides, maybe we can come in from a different angle, for example, and try to approach the bone we're trying to move in a different way. There's a lot more opportunity to get creative. And the auto adjudication rate with independent TPAs is quite low, oftentimes in the teens to low 20s. So one individual is actually looking at the claims and touching and feeling them before they get paid. What are the downsides, though? In most cases, an independent TPA doesn't own their own network. So we're going to be using other networks that other people own or have created that we then need to rent access to. And oftentimes, more often than not, that translates into inferior discounts. What I mean by that is if we take the same claim and run it through Blue Cross's proprietary network, they're likely going to pay less than we would if we ran that same claim through an independent rental network, for example. So we're already going to be giving up some dollars because we have less of a discount in that environment. So we need to make sure we're playing the game more aggressively to make up for that if we want to win. Third, there's no brand name in many of these cases. If we think about a TPA here in West Michigan that's actually owned by Health Alliance Plan, which is owned by the Henry Ford Health System, that's called ASR. Many people have never heard who the heck ASR is. And if I named 15 different TPAs, you've likely never heard of them. And so that's a challenge when we're trying to meet with new employees and tell them about the health plan that we have. They are not recognizing in many cases these names that we're talking about. So that can be a competitive disadvantage. If we're going to play a game like this, if we move back to our carrier administrative plan here, boy, this is a pretty easy game to play because there's no pieces at all to play with. If we come down here, it's way more complicated, which is great because it provides more opportunities to win the game, but it's more complicated and we're going to have to spend more time developing our strategy to make sure we play the game in a way that we can win. And then that also means that we're going to have greater member confusion. If we hand them a carrier card, it's pretty straightforward. They know how to use it. They've used it before, and there you go. But if we hand them an ID card that's fully custom with lots of logos and names they don't recognize, that can confuse the member, and it's going to take more work on everybody's part to make sure that they value the plan and we're getting the outcome we're looking for from it. Okay, so let's talk about data real quickly as well. So we are big believers that the more information we can have about a plan, the better. I'm a political science geek. I'm a Ronald Reagan fan. And there was a point in time where he was standing in front of Mikhail Gorbachev back in the height of the Cold War. And he used this Russian proverb, proverye, which meant trust but verify, saying, hey, listen, we want to reduce the number of nuclear weapons we're using and you do the same, but we're not going to just trust you. We want to come over and see, and we're going to invite the opportunity for you to do the same. In a carrier administrative model, we basically need to take their word for it that they're doing what they're telling us, and that's it. Where ultimately in a TPA model, it'll be more easy for us to trust but verify. Now, that doesn't mean one's way is right and one way is wrong. It's just how we view the world, and we think it's important to be able to trust but verify. And generally speaking, an independent third-party administrator is going to be more liberal in the types of data they give us. And at the bottom of this slide is just an example of what we're able to get our hands on from an independent TPA. So this is just taking a look at this is a claims file of many thousands of lines, and I just took a snapshot. So we can see a CPT code. We can actually see the healthcare provider that this was done. We actually know who the member was that had this done and the date they had it done and when the claim was actually paid. But we can see a CPT code for an emergency department visit, a low to moderate severity. And we can see that there's one unit. It was done in an emergency room, and we can see what the hospital charged. We can see what the network discounted that down to, and we can actually see what the actual discount was. So one of the key things that happens in a health plan, the first conversation when we talk about saving money, it often eventually gets to talking about the discounts we get through networks. It is really challenging to validate what the discounts actually are and how effective the discounts actually are. We just oftentimes need to take the carrier's word for it. Certainly there's ways we can go about getting to the root of it and trying to get more detail, but oftentimes that's a high cost exercise to go through, and it still leaves some gray out there that we just can't make our way through. With an independent third-party administrator, it is black and white, or in this case, gray and white, right in front of us, very easy to determine, is what we are being told happening actually happening? So this is a way for us to kind of illustrate the difference, and we're not trying to say one way is better than the other, but in a commercial carrier model, you are kind of on the outside looking in, asking this carrier you've hired to manage all the moving pieces behind the plan in your best to your best benefit. And it's hard for us to kind of peek around the curtain and see if that's actually happening or not, but that's what we're looking for. On the right-hand side is if we pick an independent administrator, we're going to start with you and put you at the center and put that independent administrator around you and then pick all the moving pieces. But it takes work to pick all those pieces. And it's confusing sometimes for both you and the plan participants. And so this is not necessarily the best model for you, depending upon what your reality is. But this is ultimately the difference between from one end of the spectrum to the other. One thing to keep in mind when we're talking about data, if we're working with a commercial insurance carrier, Oftentimes, they're going to limit the access that we have to specific pieces of data due to HIPAA, as we all know, and the PHI, or protected health information. They're going to say to us they can't share certain pieces of information about what's going on within the plan because of HIPAA rules. I want to just make it kind of very clear once and for all, for those that are the HIPAA privacy officers within their organization, they can have access to PHI. And HIPAA includes something called the Treatment, Payment, and Operations Exception, the TPO. And it allows healthcare organizations to use and share patient information for treatment, payment, and operations without patient authorization. So for your perspective, why that's important, if you're managing a health plan, you're talking about the payment component. And the payment aspect, of this exception enables covered entities, you, the employer, to use and disclose PHI for financial activities related to healthcare services. And this includes billing patients, processing insurance claims, verifying insurance coverage, and coordinating benefits among different health plans. The bottom line is, if you're the PHI officer within your organization or part of that team that has access to PHI, you can have access, or you should have access to this data. It's more challenging to get all of this information in a carrier model for various reasons, and it's generally pretty darn easy in a TPA model to get your hands on it. Now, we've heard employers tell us, I don't want it, I don't want to know about it, and I just want to know that the carrier knows. Perfectly fine, not suggesting that you need to go down that path, but if you want to, I want to make it clear that you should have access to this. You can have access to it, and your partner should make it easy for you to get it. Okay, 2 more slides here. Number 1, regardless of who you pick, as I talk about the carrier-based model, it gives you more limited data than a TPA may. However, you do not need to rely on your plan administrator to control or dictate how much information you get and how you see it. There are lots of third-party data providers or data analytics firms that can help you slice and dice the data in many different ways. And oftentimes, carriers will even send claim data over to these third parties so that then you can analyze it however you see fit. There are ways for employers to get this through their benefit advisor. That's oftentimes one way that benefit advisors like us might try to hang on to a client, is by running their data through a software system that we buy. But you also, as an employer, can buy them very cost effectively and control your own destiny. In a carrier-based model, it's not uncommon for them to charge you to send this data to a third party, but it's generally a pretty nominal fee, and it shouldn't dictate whether or not you do it. So ultimately, if having data is important to you and you like the benefits of a carrier-based model, there are third-party solutions you can add to the mix to get more information than you would in a traditional carrier model. All right, so some final thoughts for you here in the last 2 minutes. So what should you be doing if you have an opportunity to control the direction that your employer goes and the plan that you offer your employees goes? What should you be thinking about? First and foremost, how big of a role do you want to have, or do you want your advisor to have in plan management? If you've got way too much on your plate and saving X% of the healthcare costs really isn't going to move the needle for you, maybe you just want to have a plan you can set and forget. And there's some great options there for you. Or maybe you've got too much on your plate, but you want your benefit advisor to be able to offer guidance and help control the direction of the plan. If that's what you want, you may be leaning towards a carrier affiliated TPA or an independent TPA model. Also, how important is a brand? If you're in a highly competitive industry and you just care about having warm bodies that show up to work every day, maybe having a confusing health plan or one that's not readily recognizable by your employees is a priority for you. Just being able to say that, hey, we've got Blue Cross or other commercial carriers is just the easy button. It's kind of like nobody ever got fired for hiring IBM. Can't go wrong there because we got bigger fish to fry. And finally, how much money do we want to save? Because ultimately that's what we're trying to do, is play the game. And if we want to have more game pieces to play the game more aggressively, we need to think about what our definition of success is. How much do we need to reduce the cost of our plan to really want to step outside of the box and start thinking more creatively and doing more creative things? If it's 10% or 20% or 30%, then that might push us and we might drive, hey, we want more game pieces so the ability to win the game is greater. But if, hey, you know what? Gosh, if things just kind of stay the way they are and we're not too concerned about cost, then you know what? We may not need to play that game that aggressively, and a carrier-based model might be perfectly right for you. Ultimately, there is no right or wrong answer. It's just what the best fit is for you. We just want you to understand the pros and cons of each model and what you will or will not be able to do when you have a when you pick a particular plan administrator. So I appreciate you taking the time to walk through this with me today. I haven't seen any questions, so I'll give you just a second if there's any Q&A from everybody that we want to touch on. Otherwise, we'll wrap this up and we'll record this, put it out on our website and put it on social media so you have the access to see it. And I invite you to join us a month from now, the last Wednesday of March, to talk about provider access, where we're going to dive into networks and things like reference-based pricing and direct contracting. Thanks so much for your time today. Have a great day.